Greetings all, Dr. Zilke the Fall Fixer here. In this video, I'm going to answer a question that I get in the office quite regularly, which is, how do I know whether or not I or someone I love needs to use a walking device? But first, please hit the like button and subscribe to stay updated with my newest videos, and I'll see you on the other side. Do I need a walker? Do I need a cane? Does my husband or wife need a walker or a cane? How do we know? Well, it's a complicated question. It really is, because there are so many factors involved. Your medical conditions are a factor. Do you have heart disease, diabetes, neuropathy, really bad knee arthritis, right? Dementia is a factor with this as well. So there are multiple considerations to answer that question. But it can be broken down into some basic ideas, which I'm going to explain in this video. But first, I do need to do a disclaimer. If you are having acute medical conditions where things are legitimately out of the normal, heart disease, like I mentioned, a lot of pain, please see your family physician, have a conversation with them. If you need to see a physical therapist, see them. This is not intended to be a replacement for one-on-one quality physical therapy. Not at all. This is just a guideline for information purposes, some things that you can learn at home to take better care of yourself. But so that being said, there is a test that we commonly use in the office, in home care settings, clinic settings, hospital settings. That is a really easy and effective test to see where you are on fall safety. It's called the Tug Test. Tug stands for Timed Up and Go Test. And it's something I'm going to share with you right here. So on the computer here, I have a PDF from the CDC. And it's simply here, the Assess Timed Up and Go Test. So this is something you can download on your own. I'll have the link in the bio below. So please click it. You can look at it, print it off, and use it for your own reference. But I'm going to talk to you about it right now. So Timed Up and Go Test. They say its purpose is to assess mobility, equipment, a stopwatch. Stopwatch will work, your phone will work, but really you don't need to go to the hundredths of a second. Any clock with a sweeping second hand will work just fine. You also need a chair, as I'll say in the directions. So here's what you do. Patient or you wear your regular footwear and use a walking aid. So if you use a walker normally, use it for the first part of this test. Cane, same thing, just use it for this test. And I'll explain more about that in just a little bit. Begin by having the patient sit back in the standard armchair. Armchairs are helpful, but it's not an absolute deal breaker. It is a deal breaker if you can't sit up without pushing off your arms, but if you can sit up without pushing off, stand up without using your arms, then you would be okay. And identify a 3-meter line or 10 feet away on the floor. What I recommend is using a significant boundary, such as the edge of the refrigerator, such as the edge of the door, and set the chair 10 feet back from that. It just makes it a lot easier than trying to put some tape, a pencil, a ruler, or whatever on the floor. Just do it that way. Okay? So here are the instructions. When I say go, I want you to stand up from the chair, walk to the 10 feet line, whatever that may be. You turn around, walk back to the chair, you turn around, and sit down again. So on the word go, begin your timing. And then you record after sitting down. So it's when bottom lifts up, timer starts, all the way there, all the way back, bottom sits down, timer stops. That's it, right? And you record that time. The only data, the only information you record is the time. And we'll look at that. And there's a place to put it right down here. The CDC has their recommendation down here. An older adult who takes greater than or equal to 12 seconds to complete the tug is at a risk for falling. That's true, but there's a range in that. And this is really the information I want to give you, besides the tug test, which you can do easily at home. 12 seconds is there, which I don't disagree, but I want to give you another number. The other number is 20 seconds. And we classically look at 20 seconds as sort of the point to where someone can walk safely on their own or not safely on their own. So if you're slower than 20 seconds, we consider you to be a little unsafe for whatever reason, or physically or maybe cognitively, that you can't quite handle it. Anywhere from that 20 to 12 seconds is the range where you can walk on your own, but that's where you may need a little bit of an assistive device. There's a range from, say, 18 to 22, which is a little bit of the gray area. And that's an area where we see people, yeah, you kind of need something, but a lot of times you don't. You're not really unsteady. Sometimes you may just make a bad decisions, or your walking's not that good. You may just catch your foot on the carpet or something of that nature. The 18 to 22 is a difficult range, and that may vary from circumstance. Either maybe you need one outside the house, but not inside. And again, this is where someone in your sphere can give you some better advice than I can on the YouTube channel. But there's that range. So if you're generally under 18 though, you really probably don't need a walking device, unless of course you have pain, but that's a different subject. So that's what I want you to know about the Tug Test. You can do it at home, and you can do it routinely to see where you or someone you love really is. And if last month they were at a 15 and you think things are awry, and redo it, and this month you're at a 20, well, maybe we're going the wrong direction and we should get some help. So pull up the link, have a look at it. I thank you for your time. I really do. Again, please hit the subscribe button. Please like the video. And by all means, share it with someone who you think could use this information, who may have some fall problems. And let's keep everyone safe. Thank you very much, and I'll see you in the next video.